We all love living in the Sunshine State, don't we? Well, sometimes that sun can have negative implications. I'm not talking about just premature aging. I'm also talking about skin cancer. And I am so glad to be back with Dr. Rosh again to shed some light on this and how she's helping patients, including Ben here, who we're going to get to in just a second. But let's go ahead, start off with you again, Dr. Rosh. Give me an idea of how you are able to help the gamut when it comes to the signs of the sun, which, let's be honest, there's a lot of negative ones, aren't there?
Well, living in Florida, we love to enjoy the Florida lifestyle. That includes getting lots of UV radiation, unfortunately. And so our consultation, whether you're coming in just to check a lump or bump on the eyelid or coming in for a true skincare consultation, we're able to kind of talk about it all in one time. So I tell patients it's really important to wear sun protection, whether it be a hat, sunblock, etc. We go into detail about that. But even these cosmetic lasers, yes, they're cosmetic and they get rid of reds and browns on the skin, but really they're actually able to decrease your precancerous load on the face because you're taking off the top layers of the skin. So it's really nice to kind of bring it all in together. I'm able to counsel patients to help prevent these from coming back, but also fix if they do have a lesion that we're worried about, we biopsy it, and if it requires further surgery, I'm here to do that as well.
Well, let's dive into that, because I know you have a treatment that we're going to spend some time talking about, a treatment that I had never heard of, but you've been able to see positive results for those who are battling skin cancer.
Yes, Mohs reconstruction is really the gold standard. So patients come in to see me for an eyelid lesion. I'm able to biopsy it for them. Depending on what the pathology comes back as, I'm able to call on my Mohs colleagues who are specially trained dermatologic surgeons, and they're able to remove the cancer in its entirety and then send them back to me for reconstruction.
And I'm assuming you say this to all your patients, but she calls all, especially Ben here, her favorite patient. I've heard that. I'm just going to say. So
favorite patient.
I got to bring Ben in on this. And Ben, you were very open, with your story. Talk about what led you to Dr. Rosh here, and of course the treatments that you've been able to endure and of course see the benefits from.
Sure, absolutely. I had a little red dot that appeared on my eyelid, and I knew it wasn't right. I went to 3 different doctors trying to get somebody to tell me what it was and to treat it, and nobody was willing to. So I came down and I met Dr. Rosh, and I immediately felt completely comfortable. She's a godsend. She just said, I have it, I know exactly what to do. She walked me through it. I had 3 surgeries on this, and I don't remember much of what was said because I'm thinking about the surgeries. But I remember how I felt, and I remember how constantly they made me feel very comfortable. I was in the best hands, I knew I was, and everything that they said they were going to do, they did. They would call and follow up with me just to say hi and see how I was doing, and
here you are.
Here I am.
I'm glad he's here. Of course, he's smiling, he's talking about it. I want to make sure, though, that we have enough time to talk about the ideal candidate out there, the ideal patient, if you will. You, of course, were referred to, for Ben here, but give people an idea who are, dealing with something right now with skin cancer related, or again, the cosmetic effects of the sun. What would you say to those people? Who are those ideal patients out there?
So, I always say patients know their bodies best. If you think something looks weird, something's not quite right, come on in, let me take a look at it. Because doing an eyelid biopsy is a minimally invasive procedure, but can give us a whole lot of information. And if I'm able to preserve your vision, preserve your eyelid function, and give you a fantastic cosmetic result, that's what I'm trained to do. And that's what I want to tell patients. Don't be scared, just come in. My goal as an oculofacial reconstructive surgeon is to make you feel comfortable throughout the whole process.
And again, just being able to do the gamut from just those premature aging signs that we get from the sun all the way up to skin cancer. I'm so glad we learned more. And again, it was interesting. Ben brought up your credentials again and Dr. Rosh's experience. If you want to learn more about her experience, credentials, or of course, office locations and contact information, just check out our website.